Hey guys, my name is Manno. We've got Jeremy Coe here from Osteo West out in the West. We're really pleased to have him on board. I just thought we'd start off a bit of a mastermind group. This might be the first of many. We'll see how we go. Just want to try and give some of our clients and our community just some tips and tell them about osteopathy and give them some ideas on what they can do in these sort of challenging times. So I'll introduce Jez and tell me a little bit about yourself, Jez.
All right, I'm Jeremy. I'm at a clinic called Cone one down in St Albans called Osteo West Health and Sports Clinic. So we just introduced some online based osteopathy consults, and basically we're looking to arrange and give an opportunity to give an alternative to treating people where obviously we might go into lockdown, which is very likely in the next 48 hours. So in that time frame, we'll give you some strategies, and me and Mark will talk you through some ways of coping in isolation. It's not total isolation, but we'll give you some tips and some strategies as well.
Awesome. I just want to ask you, Jez, before we kick off, I've got one question that I like to ask. What food would you eat until you can't eat anymore?
Well, I would have eaten broccoli, but it's gone up by $12, so I'm not happy about that.
Is it $12 a kilo?
$12 a kilo. Stop hoarding the broccoli. That's all I can say. That's what I would say.
Nice, man. Nice.
How about yourself?
No, come on, man. You know what it'd be. A nice big bowl of pasta, man.
Nice Italian style.
That's it, man. That's it. Perfect. Just give us a brief intro of what osteopath is.
So basically, osteopaths, we look at the body as a whole. We use a range of techniques with soft tissue work, such as massage, stretching, mobilizing and moving joints, and also looking at the organs and structures around it as well, if it's deemed necessary. So our main aim is trying to find the problem rather than just what your issue is, whatever you're coming with. So an example is, if you've got lower back pain, we won't just look at your lower back, we're looking through your whole spine, through your hips, through your knees, and possibly your ankles as well, to see how biomechanically that might be impacting or causing your injury. So we'll like to identify those issues, and from there we'll obviously try to give you the best management and strategies for that.
That's fantastic. Cheers, Jez. In these sort of times leading up to the lockdown, what sort of precautions have you been taking in the clinic in terms of hygiene and things?
Yeah, so a lot of clinics have done the infection control course set out by the Department of Health Services, and prior to that, I think that's common sense for us in our field as practitioners. But basically, we've taken off a lot of towels, and obviously the towels are the terry cloths we've taken off, but towels we change every single time. We also disinfect the whole table, anything that's been touched or any high traffic areas. We've basically clean as well with alcohol and disinfectants.
Open at the moment, or?
We are, but obviously with the status happening at the moment, we're just waiting for ARPA or Department of Health and Human Services to come back to us.
Yeah. Cool. I still think though, we can really help our clients and our communities. I'm in the southeast and you're up in the west, but I still think we got the dog there. I think we can still offer a lot to our clients, even though we may not be doing face-to-face consultations. We can still do over the phone consults, or we can do case conferences. We can even do things like this now, where we've got multiple ideas on a similar issue. We can do report writing and try and help people with any sort of medical cases and things like that, and give them some guidance on their injuries. Have you done any sort of ergonomics or workstation stuff in the past at all, Jez? Or
Yeah, and that's what we're offering as well, and just giving clients, especially now with the high demand of home offices and working from home. So we have that option. We can assess you online or with pictures and go from there. Really,
Yeah.
you've introduced that as well. Is it at your practice?
No, I haven't done too much of it, to be honest. But I think, I do like to get some feedback from clients in terms of photos of their desk setup. Try and just make some simple strategies to help them, minimize any sort of neck pain and back pain while they're going to be self-isolating or, working from home. Did you have any other tips for like our emotional well-being and mental health during this sort of time?
I think this sort of time is it's impacting everyone. So everyone copes differently. I think it's important to get the positives out of everything you can. Because it's not the nicest time for anyone. A lot of people are losing their jobs. Obviously, financial pressures and emotional stress for the families and the point of view is we just got to be grateful. We're healthy, and we need to look after ourselves to be able to look after our families. So eat well, move, exercise, talk to someone, find some support, get your good networks around you, and have a little vent, but don't blame. Let's just work together and combat this and rebuild and unite as a country or as a whole, as a human race, really.
Yeah. And I think you're spot on there, Jez. That attitude of gratitude. I think that look, we can always look at the things that we don't have, but we've got plenty of things to be grateful for. Every day is a blessing. In these tough times, like always want to try and be thankful for the things that we do have, because it can all be taken away from us the next day. So as we've seen, in these past few weeks and coming months. So you're spot on. Getting your family involved and getting those support networks, I think, is really important. Just keeping connected, like even though a lot of people might not be working and might not be earning income, but if we can focus on developing ourselves and trying to improve the skill set that we have, this is probably a really good time. If everyone's got access, or most people have access to an internet connection, so this is a really good time to develop skills and try and my philosophy that I'm trying to get across to my patients is what is their view. So you may have heard of this, Jez, but so we break it down. So V is for vision. What's your vision for your health, your finance, your emotional well-being, your relationships? What's your vision? Then I is for intensity. So, in 90 days or less, anything can change in that time frame. So we want to try and, what's our vision? What's our intensity? And we want to have a bit of enthusiasm and really be positive and what brings us joy, how do we apply a positive mindset to that vision? And then the W is the why. So, why do we want to achieve that goal, and how do we address that in a positive way? So, no,
that's good. That's touching all bases, and it's important, like you said, gratitude. Look, it's unprecedented what's kind of happening, and there's people dying, and obviously there's a lot of people are fighting over toilet paper. It's just insane. So it shouldn't be happening, and I think we've got to set examples for our kids or nephews, nieces, or our environments as well. So just because other people are doing it doesn't mean you need to be doing the same thing. So we can't control that, but we can control what we do as to reflect on everyone else as well.
Yeah, spot on. We can only control our 50% of the bargain. Like if we can if we can be kind to ourselves, that means that we can be kind to others. So Did you have you been planning any sort of exercise regimes for yourself or your clients, Jeremy?
Yeah. So obviously, yeah, with clients as well, and touching base with them, and just going through their rehabs, and obviously depending on the complaints, I've been assigning them certain exercises, and checking up them as well. And obviously for myself, I've still been going to the gym, but I've been quite vigilant with my cleaning and cleansing of equipment, touching things, and ensuring that I stay away from peak times as well. But saying that, obviously, I've got power bands at home. I've got some weights and kettlebells, and probably be a few exercises coming up on the good old Instagram page. So
that's it. We'll put up the link to your Instagram and the website. I know you've been doing a lot of work there, and you've been putting up some great content as well. So that'll be great for any of our followers here tonight.
How are yourself, mate? You got the dog to walk around the house?
Yeah, that's it. No, she's having a snooze now, but I'll definitely be getting her out for a walk and play out the back. I've just set up a little bit of a YouTube channel, so very similar to what you've been doing with some exercises, and trying to give out some free content for people just to keep them active, and try and tailor it to my clients' injuries, but it's a work in progress. There's always something that you can do, and it's a bit of a journey when you have an injury, but all injuries they always happen for a reason, so yeah.
What do you find the most common injuries you assess or see in your consults?
Yeah, a lot of things that I see is lower back pain. I see a lot of acute low back pain. Generally, it'll be after they've lifted something heavy, or sometimes it can be if they've trying to take a plate out of the dishwasher, for example, and they'll get an acute back spasm, or their lower back will start to flare up, and they might get some pain going down into the buttock or down into the back of the leg, which is very common. And this can be managed, with some really good education, because sometimes conditions that might present with a lot of pain initially, after 2 to 4 weeks, that really sharp pain sort of starts to subside with some treatment and some guidance in terms of what to do and where to go. And I think that's really where our role as osteopaths and other allied health professionals can really come in and sort of save the day and guide people along the journey. Is there a particular area that you've been specialising in, or you've been seeing a lot of patients lately?
Yeah, I think it's the same, lower back and neck headaches. Particularly now with people that've got their incorrect setups. Definitely want to address those. And, some of the tips are so simple, but, keeping close to the desk, keeping your screen, a decent height, so you're not extending up or looking down excessively, or even slumping over. And keeping objects as close to you as possible and comfortable to do so as well, and also get a good decent seat. So but try and get that before the shop's closed. So don't buy over
it. Stock up on all the essential items.
You got 12 hours.
I haven't done any shopping yet, so I better get out there, I reckon.
You look like you got a decent seat, so you'll be fine.
There's more things you want to chat about. I'm more than happy to open up the field.
We'll keep the full episode too, I think.
Maybe we can get Ronnie and we can rope in a couple of other colleagues into it as well.
Well, this is the thing. I think it's the best time, what you said. You can hone in on what you want to do, and this is great professional development for us, but also gives patients or future clients or anyone an insight kind of what we can do as well. It's good. She wants to get in action as well. So
that's it. I really appreciate your time, Jez. Sorry, I know you're with the partner there and you got dinner and stuff, but I really appreciate your time, and hopefully we can give some value to our clients and our community. So
Thanks, mate. Thanks for organising this. This was good to speak to like-minded people and
yeah,
get connected as well. So
yeah, that's it. We'll try and serve ourselves and our community as best we can during these tough times.
no, well said, mate.
Awesome, man. I'll